In a hospital, we meet all sorts of people, and we don't always know how best to welcome them all appropriately, like when we meet deaf patients.
Deaf patients should always have access to a registered sign language interpreter. Here's how you can help and interact with deaf patients if an interpreter is not present.
Firstly, it is important to find out the deaf patient's preferred method of communication. To first get the patient's attention, a simple hand wave and smile can be effective. You need to face deaf people when you're talking to them. Stay in their field of vision, maintaining eye contact. Speak clearly rather than shouting. Many deaf people can lip read to an extent, and shouting will distort your lip movements, making it harder for them to follow. Be prepared to repeat things, and if the person still doesn't understand, try rephrasing or using mime and gestures to help them understand you better. No one can lip read multiple people at once. If you're in a group, take turns to speak one at a time. Even the best lip readers can usually only understand around 35% of what you are saying. Begin by clarifying the subject and let the deaf person know when you change it. It is easier to lip read when they know what the subject is. If you are struggling, try writing it down. Just because a deaf person is with a friend or family member doesn't mean they are an interpreter. Never assume it's okay to tell a friend or family member private information. Always ask the patient first.
When communicating with a patient using an interpreter,
always face them. The interpreter will relay what you are saying to the deaf patient. Think about learning a few basic signs. Hello, thank you, and goodbye could be the difference between someone feeling welcome or feeling unwelcomed. Every deaf person is different, so you'll need to be flexible in your approach. Remember, being deaf does not mean being incapable. Take your time and don't make assumptions. Patience is the most important thing in building strong relationships.